We're seeing that this has positive psychological effects, and now it's being looked at for a multitude of things like major affective disorders, depression. We know that it's used for post-stroke spasticity, migraines. It just goes on and on. So it's been a really, really fascinating drug.
So it makes you look better and feel better.
Our guest is Dr. Rui Avelar, who arguably, to me, is one of the most knowledgeable experts in the world on neurotoxins. Head of research and development, as well as the chief medical officer to Evolus. And Evolus's neurotoxin is Jeuveau, happens to be a product that both Dr. Danielpour and I absolutely love. But you're going to learn next level information here today. And so we're so excited to have you. Thank you so much for coming.
Thanks for having me.
The nice thing is we've heard you speak many times and always have been very amazed. I'll be honest, I fall asleep easily during lectures. And every time that I hear you speak, I am at the edge of my seat and I learn a lot. So for all the listeners, you guys listen up. You're going to learn a lot about the most common cosmetic procedure in the world. And in my opinion, and I know Dr. Lakey's opinion, probably the best treatment to really halt the progression of aging. So for everyone that always listens to our podcast, we always say the number one thing you can do to slow aging is use a neurotoxin. Again, neurotoxin, you guys know it as Botox, but there's multiple different brands. And today we have Dr. Avelar here to really kind of educate us. So thank you for being here.
Oh, thanks so much for having me.
I was going to say, listen, there's so much to talk about, but I definitely want to start with kind of you have such an interesting history. And the reason why I think you're the most knowledgeable in this space is because you've seen the gamut. But listen, I'm going to let you run away with it. Be prepared to be wowed, people.
Always. It's just like, I think that there's a saying, when the neighbor moves in and says, "Oh, we're completely normal." That's when you get worried, right? Setting a standard.
Yeah, exactly.
Yes, thank you. I sat on your side of the street, and it's kind of interesting to go into industry. It's a complete different perspective. I was going to jump on the comment that you made in terms of toxins and slowing the progression of aging. And, we do see that. One of the things, there's actually, believe it or not, science behind that. We did a really large study that had almost 1,000 patients in it. But quite often when you see these big trials, you get one treatment and then the patient gets followed. We did one study where it was 1,000 patients basically, and followed them for a full year. And patients, kind of like in real life, you don't have any wrinkles, you don't come in. If wrinkles start to come back, you would come back and get retreated. At the beginning of the study, over 90% of the patients had like these embedded wrinkles like I have. And so the interesting thing about that study was what happens when you relax that tissue for a year? Can stuff regenerate? Can it get better? And lo and behold, at the end of the year, we looked at patients and we looked at the wrinkles at rest, which is kind of the damage. Between 70 to 80% after the course of 1 year, we're already seeing improvement and reversal, kind of regeneration improvement of the tissue. So it does have some nice powers.
So the interesting part is that people say, is it too late for me to do neurotoxin? And no. You have the evidence right there. I mean, obviously, if you let yourself go for too long, it's maybe too late. But generally speaking, it really does help. And I could say it for myself. I remember coming out of residency and looking at myself and wow, I have such deep wrinkles everywhere. And we ended up injecting ourselves. And I tell you, I mean, these deep wrinkles that were there in my forehead and my crow's feet and my frown lines, they're gone. And I don't even do it as much as I should, but it really makes a huge difference.
Canadian born, bring me through when you arrived here. I understand that you practiced medicine, and what was like the tipping point to bring you into industry? And it's interesting because you didn't start at Evolus.
No, I didn't. So I am Canadian born. I trained in Toronto, medical school in Toronto, and then practiced in Vancouver, British Columbia for 20 years. And the thing about Canada is it's a socialized medicine. And so I played in two fields. I was in the public sector, but I also was in the private sector. And as you mentioned, one of the teams I looked after was the Vancouver Canucks, which is an NHL team. And, the government was basically saying, we can't have a two-tiered system. You can't have private pay. This is evil. And the irony is the number one user of the private sector was the government. So
It's funny how that works.
So I had a really fun career. I had a great time, and it was just kind of a natural progression to go do something else. And the way I ended up in California, ironically enough, was as the chief medical officer for Allergan.
All right, guys. So Allergan is the maker creator of Botox, cosmetic, and as well as its reconstructive product. But it's interesting because a lot of times we use that interchangeably with any of the neurotoxins because people recognize that. Mm-hmm. But I think that's slowly starting to change. And you were there as their CMO as well, and their R&D team. And it's interesting to me because now you've seen these true neurotoxins from inception now to the evolution of what we have available to us. So I'm curious to get your take on it.
I've learned a lot, and I continue to learn a lot. And for those of you who don't know the history of
I was just going to ask
toxin,
you that. Took it right out of my mouth.
It's kind of a really fascinating thing. Many years ago, there were a bunch of Germans having sausage, and a bunch of them died. And so they kind of reversed engineered and realized that the sausage had this bug in it called Clostridium botulinum, and it made this toxin. And then a guy by the name of Scott kind of thought, we can leverage this thing that relaxes muscle and do something good with it. So he was treating patients with ocular disorders, people who were cross-eyed, strabismus. And the way it came into aesthetic medicine was kind of really interesting. It was Gene and Alistair Carruthers, two dermatologists and ophthalmologists in Vancouver. And they just made the astute observation and listened to their patients. A patient came in and said, you're treating me for this eye problem, but my wrinkles are gone. So they did what every good clinician does. They did their trial, which means they went and grabbed their secretary and said, come here, I'm going to inject you.
Yes. Guinea pigs?
Yeah. And lo and behold, they're the ones who really should be credited with this whole movement. Allergan did a really wonderful job in investing and building this community, and they, people like Mitchell Bryn and David Pyatt, who's CEO, they were pioneers in bringing all this stuff forward. But it's interesting. We're obviously talking about the aesthetic benefit here, but one thing that a lot of folks don't realize is there may actually be this central benefit. And there was a really interesting paper that was published by a guy named Lewis, and I believe he was out of Cambridge in the UK. And a lot of people were saying, I just feel better. And is that because the way you look, or what is it? And what he did was something really interesting. He grabbed a bunch of folks who had like filler or some sort of aesthetic treatment, and then the other half that had a neurotoxin treatment. And then what he did is he looked at aesthetic improvement. And turns out that both those groups had the same amount of aesthetic improvement. Okay. Then what he did, he looked at irritability, anxiety, and depression. And when I speak about irritability, anxiety, and depression, I'm not talking about a pathological state. I'm talking about, think about yourself. I went to work, it was sunny, I had a great day.
Sure, normal, every day.
I'm happy.
Stressors.
Right? I was on my way home, I got into a fender bender, I'm a little bit depressed, and my kid got a D, right? So within that normal spectrum. Anyway, so what he did was he looked at irritability, anxiety, and depression across these two groups and found that those on neurotoxins were actually scoring much higher, much better when they looked at things like depression and anxiety. So then he did another study, which was really interesting. He grabbed a bunch of people and basically put golf tees on their forehead. And then he would give them an image or a passage or something to look at or read. And then you would look at this passage or this image and you would score it. And you could either look at it kind of normally, Or he would ask you to bring the golf tees together. Now look at this image. So to bring the golf tees together, he was actually asking you to frown without telling you to frown. And the interesting thing is when you frown or bring the golf tees together, you perceive things more negatively. The images, the passages were all perceived more negatively. So it's a long way of saying when you relax those glabellar complex muscles, people perceive things less negatively. And this led on to other things and started, what about treating depression? And there was a small series, about 12 patients, this kind of got started, where a bunch of folks who were on antidepressives who really weren't doing well, they got treated, and the majority of them actually came off their antidepressants. Wow. So we're seeing that this has positive psychological effects, and now it's being looked at for a multitude of things like major affective disorders, depression. We know that it's used for post-stroke spasticity, migraines. It just goes on and on. So it's been a really, really fascinating drug.
So it makes you look better and feel better.
Yeah, I mean, especially with today's mental health issues and things like that. I mean, again, I think the possibilities there seem to be very positive.
Now, for those that are listening that don't know, what are really the indications and what can neurotoxins be used for? Now, I mean, you could start and talk about cosmetics, but we just had a little talk before this started about how therapeutic uses of neurotoxins are even more prevalent than using it for cosmetics. Just so the people that are listening understand that this can really be used for significant problems that have no solutions, and it could be a really easy fix.
When it started, it was, for people who were having trouble with their eyes, the muscles that were making you cross-eyed, instead of going in and surgically cutting or releasing a muscle, you could simply inject it and relax that muscle so you can align the eyes. Some people have that twitching, and that's been wonderful because we live in a society where your facial features, as you all know, people will judge. And having twitches or having these tics are things that can be problematic. We know that people who have had strokes and look asymmetrical, we're able to relax the other side to create symmetry. We've seen things on the therapeutic theme. I mentioned migraines. We're talking about things like depressions. We're looking at people who've had strokes and have either upper limb spasticity or lower limb spasticity that we can treat. And, some people have bladder issues, and we walk around without any issues. Some folks can't be more than a stone throw away from a bathroom, be it because of a spinal issue or something iatrogenic or idiopathic, and we can actually treat that with this. So, and we continue to broaden it. We're now looking at even potentially treating for scar.
There's some papers about that,
That's
using
right.
facial scars and injecting Botox directly into it, micro-Botox, showing that by relaxing the area, the scar can heal better, which kind of makes sense, right?
It does.
So, yeah, it's amazing the different indications that a neurotoxin can be used for. Now, in this practice, we really use it cosmetically more than anything else. And when we inject it into, you use it for your frown lines, for your forehead lines, for the lines around your eyes, which are the crow's feet. But then you can use it to really relax the jaw, for the masseters, for people that really grind. These are things that, people have such problems, get bad migraines or headaches or break teeth. You put a little bit of a neurotoxin into the muscle, the masseter, and it really kind of relieves it into the neck for the necklines. I mean, we can keep going. Now there's something called trap tox, where they're putting significant amount of Botox in the trapezius muscle to relax the shoulders. I mean, we can go on and on and on. There's a lot of really great indications, and it's a very easy procedure. Most of these procedures take 5 minutes to do, and they last for about 3 to 4 months. So it's something that can be used all over the body.
It's interesting because some of the feedback that we've gotten or the questions that people send in are, how do I know which neurotoxin is the best or right for me? And it's interesting because as physicians, we're very data driven. And so we look at the studies and we say, all right, this one looks like it's better. Looks to be more efficacious, even though the rep from every single company comes in and says, this is the best, and here's why, and we've got this, but you have the luxury of kind of traveling from one monster company to another that is rapidly growing. And I think we can both agree that Jeuveau is an amazing product. And again, I'm not a salesperson for Jeuveau, but the idea is, we want to give the best clinical outcomes to our patients because ultimately they're happy, which makes us happy. Why do you feel at the current time that Jeuveau is a superior neurotoxin? I mean, if we look at the history of where Botox came from and how long it's been around, obviously when something's around for a long time, we assume that's the gold standard. But eventually there are some chinks in the armor that we start looking at, and when there are when there's new technology and new products and things like that, we want to evaluate and kind of look at head-to-head evaluations. Where are you along, that spectrum?
I'm going to do something completely unorthodox from a company perspective, and I'll start with complimenting all the toxins that are approved. I mean, if you have a botulinum toxin that has undergone the scrutiny of the FDA, you have a good toxin. And I would suggest that, the toxins that exist in the U.S., they're all pretty darn good. And clinicians such as yourself, I mean, you're masters at what you do, at your art. That's why you're here. Having said that, when we started, we recognized that Botox is the gold standard. And when we were coming in, we were going to be the fourth entrant. So the pedigree of Evolus, a lot of us are ex-Allergan folks. The individual who started, Chris Marmo, is an ex-R&D head. And plastic surgeon by the name of Jeff Gross was there, and Scott Cannizzaro from J&J, and small core 3. And when we started that, we were looking for a botulinum toxin that was also what's called a 900 kilodalton complex, which is what Botox is. And I know I'm getting a little
No, that's all right. Listen, we love the science. For all of the nerds out there, we'll sprinkle a little good science in there too.
That Botox is a different structure, and we just recognized that was the standard. So we intentionally looked for one. And when we found it, we licensed it in, and then we had this sobering conversation with Daewoo, who we licensed it from, and we said, okay, we're taking this to a completely different standard. And what we had was a completely dedicated, purpose-built, brand new factory built to our specifications to build this drug to our specifications. And ultimately, what's the data? And unless you have head-to-head data, really, you shouldn't compare your drugs. So we recognized that we were the fourth entrant. And as such, we did what's called the pivotal trials, the big trials that get your approval. And we went head-to-head against Botox.
And those are usually the non-inferiority studies where we look, you essentially want to make sure that it's not worse.
Exactly. It was a lot of patients, 540 patients. The entire program had over 2,000. But that head-to-head study unto itself was 540 patients. You either got Botox or you got Jeuveau. And at the end, when you looked at the primary endpoint, the placebo groups, the ones who got saline, did not do very well. Botox did really well, just high 82%, just under 83%. And interestingly enough, Jeuveau, 87%. So we took the gold standard and we came in at a really nice number. And then we went through all the regulatories. We got approval in the United States, Canada, all of the countries in Europe, and just recently Australia. The other interesting thing is we've looked at the data a few other ways. Most of the aesthetic patients, as we know, are female. We see males coming in. And what we did was we did what's called a post hoc analysis. We took that head-to-head data and said, hey, wonder how this stuff works in men. And there aren't many papers published on glabellar neurotoxins in men. We found one. And so we said, well, the data are what the data are, so let's just have a look. Men are interesting because generally speaking, if you look at the glabellar region, they tend to have a little bit more muscle mass. And in these studies, you're only allowed to use 20 units, so it's like one dose. So what happens is men tend to have kind of a less of an effect. and they tend to have less duration because you're not allowed to adjust for muscle mass. So if you're going to do a post hoc analysis, really what you're looking at, I wonder how those two drugs compare from an efficacy and from a potency perspective. And what we found was Jeuveau worked even better in men. So when we looked at things like onset, the majority of the patients greater than 50% were already within 2 days working. And if we looked at the duration, we saw that pattern. So not statistically significant because the sample size is small. And again, that's a little geeky language, but the pattern was very, very consistent. We always did a little bit better than the Botox arm Jeuveau did.
Amazing.
And then the last piece of data that we just kind of looked at, which was kind of exciting, was millennials, and that kind of speaks to your point. We were really curious to see how our data in millennials compared to our older patients. And we know that the stuff works really, really well in older patients. That's the basis of these studies. They're typically, patients over 50, 90% are female. So we have a really rich data set there. But again, very few times do you ever look at the younger patients, as kind of you mentioned. And what we found was every way we sliced it, it works even better in millennials. Just any way you want to measure it, it did. Even things like subject satisfaction, where we're wondering, I wonder, how a younger population defines satisfaction. And the scores came in we saw 100% scores.
Wow.
And it's interesting that you say this, because for John and I to change a product in our practice, it takes a lot. Mm-hmm. Because again, we're very much data driven. So we get the data and we look at it and we're like, hey, okay, let's try it now. First thing we do for most of the products, except for breast implants, because I can't put those in myself, we try it. And I'll be honest with you, from the get-go, I was sold, because these are the things I like about the product. I love the rapid onset because, as Americans, we like everything right away. Maybe in Europe it's a little different, but we want it done right now. So they want to get it and they want to see it right away. Well, obviously, no neurotoxin works right away, but I do believe that Jeuveau probably works the fastest. The other thing is the duration. The duration is as long, so it works faster and it lasts as long. So it works a little bit longer. And the third thing that I actually love about the product the most is it feels softer. I don't know how to really kind of quantify that in a sense, but just in my own face, sometimes I feel very heavy when I get Botox, whereas with Jeuveau it's a little bit of a softer feeling in the sense that my brows aren't as heavy, and it could be dose dependent or injector dependent, but I feel a lot just softer. And I think across the board, I should say, all of our patients are very happy. Now, most patients come in and they say, oh no, but I've been doing this all the time. It's like, I've been drinking Diet Coke. Well, you're going to switch me over to Diet Pepsi now? But if I turn around and I tell them, no, trust me, it's just as good, if not better, they trust the doctor. And I think that's, for us, we've had no complaints. People are like, oh yeah, this has been great. And we've moved along. It's been a couple of years now. So I have to say the product you guys have made is like your studies have shown, I think superior, if, definitely as good.
Yeah, I think, for me, again, this is an N of one, but the idea is a lot of the products that we use, we try, as you said, on ourselves first. And I noticed that I was blowing through Botox. I'd increase the dosages, and then all of a sudden you'd hit a point where you didn't like the outcome. So it just wouldn't last as long at the dosage that I preferred. And so I've tried the other products, Xeomin and Dysport, and Xeomin, I felt early onset, it just didn't last as long. No. And so for me, it just, again, and nothing against the company, other people it may work just fine for. Dysport, I never understood because it required more fluid to get the same amount of units. And to me, I wanted to be very focused and specialized, specific to an area. And you can change the dosing to try to do that, but it just didn't make sense to me. And then I came across Jeuveau, and it ended up, again, earlier onset, lasted longer, and I felt the same way. It was a kind of a springier effect, where it wasn't as heavy. You weren't either frozen or not. And so then we started using it on our patients, and we would use it on our Botox tolerant patients, the ones who it just stopped working for. And all of a sudden they would see lack of movement, and they would see the efficacy. How do you explain that?
Yeah, what are your thoughts about that? That's a great question, because you'll have people that come in all the time and be like, it doesn't work anymore. Is it a dose thing, or is it actually people developing resistance to the product?
I'll share my experience with you, and this is all anecdotal. I have no hard science, and I do want to touch on the other observation that both of you made on kind of a softer profile for Jeuveau, but structurally, this thing looks pretty close to the Botox molecule. Now, the really interesting thing is when we talk about making a device, you can look at this device, you can look at that device, and you can copy things. And you could look at it and say, yeah, they're the same. When you make a small molecule drug, you can make that look like that. There's a carbon, there's a hydrogen. You could do the analytics and they look identical. When you start playing with a biological, that's a whole different game. Here we're talking about a whole bunch of amino acids, like over 1,000. And they've all got a shape. So whenever you're developing a biologic, what you'll hear is your manufacturing process is your drug. And that's different. That's a completely different vernacular than you get anywhere else, like in science. We had a brand new building built for this, so it's all brand new machines, everything else. And so we have a very high pure drug. And if I come back to your question now, I actually got a phone call from an aesthetic physician who said, hey, I've got a patient and Botox doesn't work anymore. I was thinking of using your drug. What do you think? And my first reaction was, I don't think it'll work. They're both technically 900. Yeah. She called me back and said it worked. And I was really surprised. And then, funny enough, a little later on, I actually got a call from a neurologist here from UCLA in your neck of the woods, and it was a patient who had something called cervical dystonia. And she said, where can I get your stuff? Zeman doesn't work, Dysport doesn't work, Botox doesn't work. To which I said, I don't.
Yeah, it's good luck.
She said, Jeuveau works. A friend of mine is a dermatologist. I was quite desperate for this patient, so I got, and it works perfectly.
That's great.
Again, in fair balance, I'm not trying to say we're better than the others. I'm just saying structurally there's a difference here. And I'm sure my friends at Allergan one day will tell a reverse story here. But structurally they're different molecules. So when we hear about onset or duration or different performance attributes, it kind of makes sense. On the softer side, we've heard that quite frequently, that Jeuveau just seems to give you kind of a bit of a softer, kind of more natural look. And if I think back a little bit, when we looked at the aesthetic cycles, bell bottoms, straight legs, there was a time where the ultimate outcome was complete annihilation.
You're right.
Shiny forehead.
Right.
Definitely.
Porcelain doll, hockey puck, I wanted to look like that.
Yes.
And we're seeing a movement away from that. And I recognize it's
Very
regional.
much so.
But that has been one of the things that we've heard back. Jeuveau just seems to give you a softer, allows you to do a little bit of twitch so it looks a little bit more natural. And if I think about it from a physiological standpoint, one thing that we seem to see, we seem to hear back, is it's a very precise drug. And so where you put it, it works. And so it allows a couple of little fibers to kind of continue to work so that you don't have that heaviness and you have a little bit more of the natural look. And again, a little bit anecdotal, but this is kind of what we keep hearing.
Well, definitely. I mean, listen, it makes sense for us because we, here in Los Angeles, we take care of a lot of actors and they still want movement, but they don't want to lose their position to a younger counterpart. And so they want little bits. So what they'll do is they'll come a little more frequently. And we give them smaller amounts, and it allows them to make expressions without creating those deep furrows, and that's I think is a game changer for them.
I have another question. We discussed this at the meeting a little bit when we were all together. So there's this newer neurotoxin that's supposed to last for 6 months, and it seems like it's just dose dependent. Just a very simple correlation of, hey, if you dilute it with a certain amount and inject a certain amount, it's just going to last longer. It's that simple, isn't it?
Again, another excellent question. That's right. They have a drug. It seems like a very good drug, and they've effectively doubled the dose. And if you look at the data and you look at what they get with 20 units, and this was all published again, Gene Carruthers published that, and then you compare that to the doubling of the dose, you get longer duration. And if you really, really scrutinize the data, the increment is about 30% longer. And again, in all fairness to all the other toxins, we've seen that Siemens has also shown that when you increase the dose, you get longer duration. Dysport's done that. Botox has done that. I recently presented our interim data in Paris at the IMCAS meeting, and we also showed that when you double the dose, we get a longer duration. And although not a head-to-head study, if you look at Jeuveau at 40 units, this data is very comparable to what we're seeing with the quote-unquote longer duration. And it really speaks to you as clinicians really have that control. I mean, they're the same vials. You have that ability to look at patients, listen to their objectives, and be able to dial it up, dial it down.
It's really important what you just said, because a lot of people that are listening, I'll get this all the time, where you have a patient that come in, don't give me too much. It's that constant, or it's the person that comes in to see Dr. Lake. He says, I want a mini lift. And you really need a facelift. There's no mini lift. It's like baby Botox. It's been this term that people use. And listen, we don't give you more than you need, but there's a certain threshold where if you don't have enough, it's not enough. And people don't, it's very important to understand, it's very dose dependent. Each muscle needs a certain amount of neurotoxin for it to really have the effect. And obviously the more you put, the more quote unquote frozen it will be, and the longer it will last. The less you put, the more movement you'll get, then the shorter it'll last. But people still haven't been able to get that. And the latest neurotoxin that came out really shows that it's very just simple. It's a very dose-dependent thing. So, for you people that are listening, you don't necessarily need to get this new neurotoxin. You could just get the old one, just at higher doses with lower reconstitution. It's just the same thing.
Yeah. I don't even know if you're able to talk about any of these things, but if we look at the world of neurotoxins and, where Evolus is now and the neurotoxin Jeuveau, what current ongoing studies are there that you think are going to be pivotal or game changers or things like that? And where's the future going?
Jeuveau right now obviously is indicated for glabellar lines. The really interesting thing, and you know this, I'm just sharing it more with the audience's benefit. If we look at the FDA label and we look at how neurotoxins are used, I would suggest 95% of toxins are used off-label.
Definitely.
Yes,
not
absolutely.
the right dose, not in the right places.
Definitely.
And it kind of speaks to the point that you were just bringing up. I mean, you're pros, and you assess patients, you assess their anatomy, you listen to what they're looking for, to their objectives, and you match those. And that takes skill. And if you think about taking a drug through a regulatory process, you will never hear the terms FDA and laid back in the same breath. So when you invest literally millions and millions of dollars to get labels, unfortunately, you would never get the understanding of the nuances.
Right,
It's just
sure.
so natural for you.
Makes sense.
So that's one consideration as we think about investing in toxins and doing clinical trials. Having said that, we do have kind of a secret project going on right now where we're looking at a neurotoxin composition that doesn't exist today. It's a brand new formulation that looks nothing like anything that exists today. And so that means one of two things. It's a really great idea or really bad idea. So if it's a bad idea, if you invite me back, I'm not going to say anything about it. Instead, we at least Evolus as a company, we're looking at other things. We've wanted to build the neurotoxin franchise Jeuveau and make that the flagship. It makes sense.
Sure.
for a variety of business reasons. We're now investing, and we're bringing on hyaluronic acid fillers.
Great.
We're starting those clinical trials. We have a really cool technology there. And we're very, very active on the business development front, looking at things that are really early onset to things that are kind of later stage. And I marvel at what you do here at this facility. Like, you're so way ahead of the curve when you think about regenerative medicine and just kind of health. You're going beyond the aesthetic. You're actually thinking of the entire health of the patient and how to stave off the aging process. So we're very interested in looking at things like gene therapy and a variety of different things. So
That's great.
I think that's probably dollars better spent on an R&D perspective than trying to get a label for a nose that you know how to do already.
You're right, because we're doing it anyway, and so to spend millions of dollars to just tack that onto the label, I think is futile. So
I know we don't have a ton of time left, but I have one quick question. Ever think about a reversal agent like we do for, hyaluronic acid? And I only say this because, again, we've injected tens of thousands of people, and there's probably less than a 1% chance that there's ever a problem. But there's people that don't like their Botox once in a blue moon. And there's never been this reversal agent. So basically the way it works is if you get any type of neurotoxin, it lasts about 3 to 4 months, and that's what it is. If you don't like it, it is what it is. You can kind of make some adjustments, but generally speaking, you can't get rid of it until it goes away.
Yeah, we'll tell
itself.
people, perform exercises, try to work the product out, all kinds of things. For if it's the lid, we'll use aproclonidine, kind of. But
I'm just curious. Is it even something that you think about ever, or because it's so different than hyaluronic acid? You put it in the lip, you see it, you inject it, and it gets rid of it. This is you injected it in multiple areas. Like, how does?
Let me give you a really short answer and then give you the longer answer. So the really short answer is really tough to do. And the longer answer is kind of one of the reasons why this stuff is so safe. Like, we use the word neurotoxin, but if you take a blood pressure pill, what happens is you take the pill and then you get what's called a systemic dose. You get a certain concentration in your blood, and it only works while you have that concentration in your blood, as an example. And that's true for most drugs. Neurotoxins are completely different. What a neurotoxin does is you inject it into the muscle, and the reason why it's so safe is this stuff is so potent that you're giving a tiny whiff. You're literally injecting a couple molecules in there, and it goes to the nerve and it cleaves something. And I'm trying to make this simple. It cleaves something called the SNAP25 so that you can't activate the muscle, so it stays relaxed. That cleavage is irreversible. So you inject it, you cleave it, and the reason it takes, say, 3 to 4 months is that's how long your body takes to rebuild that SNAP25. And so once you've injected the toxin, you've got that little cleavage, and that's why it works so nice. And that's also why the safety profile in this is fantastic, because you don't have to have that systemic concentration. You don't have to take that pill every day to kind of sustain that blood level, because we just add a little whiff. It's not even detectable in your blood system. Again, why it's so safe. And so it's a really nice feature for your patients. But the reversibility, once that's cleaved, Mother Nature's got to rebuild that baby for you.
And it's interesting what you just said, because that's really important, because we didn't touch on it at all. Clostridium, it is a toxin, and it can cause paralysis, but it's given in such small doses that Dr. Avelar just said that it could never cause those issues, guys. Please listen up. People come in, they're like, I'm not putting that toxin in my body. It is a purified protein, right? And it works just locally into where it's injected at a very, very, very small level. So it's never going to become systemic. It's never going to harm you. And again, this is from the biggest expert that there is out there.
Yeah, never say never, obviously, but
Yeah.
but just to kind of do this, when I'll just kind of repeat a little bit. When you do a drug, generically speaking, typically what you do is you look for systemic levels, and the FDA regulatory bodies say, "Hey, you just treated that. What level is in the blood?" This is the only product I've ever seen that I know of. It's untraceable.
Wow.
Like, the volume is so low, the amount is so small, because it's so potent. You can't find this stuff anywhere. So
That's crazy.
That's
the
great.
nice
That's great
comfort
to know.
thing.
That's a great thing to know that, again, it's not going to be found in